Okay, so hi everyone. As you can see on the screen, my name's Antonia. So I'm currently a fourth year medical student.
Can't make it be quiet.
Sorry,
Sorry.
Eva, I think you're
I'm
not
trying
on
to
mute.
make it on mute, but actually my volume's down as low it will go, but it's still playing. You can play now, Laura. Sorry, I just missed the first. No, I just missed the first little bit. That's fine. I'm sure it'll just relate introductions
So-
and stuff
Sorry,
anyway.
Eva, I think you're not on mute. Okay. So yeah, as I was saying, sorry. So I'm Antonia. I am currently a fourth year medical student at the University of Leeds. So I'm going to give you guys opportunities to ask lots of questions throughout the session. So we're going to do this. So I'm going to start by sharing my screen with you. And I want you guys to join my presentation so that we can make this as interactive as possible. So, oh yeah, so if everyone can see my screen, could I have some like thumbs up if everyone can see my screen? Also, feel free to put your cameras on, guys. It's helpful for me to be able to sort of see who I'm talking to. Thanks, I've got some thumbs up. Okay, that's great. So okay, cool. So if people would like to try and join the Mentimeter, the code is at the top of the screen. And if you could just let me know that it's working and when you're on it. So whilst you guys are doing that, I'll just explain to you a bit about how the webinar is going to work. So essentially, I'm going to be going through some slides. At any point, if anyone has any questions, then please just unmute yourself and let me know. We're just having some trouble getting the other host into the meeting, but Bobby will be joining very shortly. So yeah, in the meantime, we're going to make a start. So if everybody's been able to, okay, sorry. So somebody's asked how long is the session? So the session's about an hour. So yeah, has everybody been all right in managing to join the presentation on Menti? Okay, so I've had some people join. Okay, brilliant. So I've got some people. Is anyone having any issues? Sorry. Okay. So okay, great. So what we're going to do is 5 past now. So we'll make a start now that I think most people are on the Menti. So let me know if you do have any issues with that. So essentially, this session is going to cover oh, brilliant. Some people have already answered. So this session is going to cover an introduction to interviews. So basically thinking about at this stage, obviously some students sometimes find it difficult because you don't know where you're going to be interviewed. And you're not really sure where to start because it can seem like quite a daunting process with lots to cover. So this is really to introduce you guys to the interview process. And basically so that you have a bit of an idea about what you can do in the meantime. Okay, so I can see that we have a wide range of universities. Okay, so Triz has asked in the chat where to access the Menti information. So I'm just going to go back on the first screen for 1 second. And then here you can see that there's the code 81201879. And that is the code to get into the Menti. Okay, so we've got lots of responses. That's great. So I can see that we've got so the bigger the word, the more applicants. So I can see basically I can see pretty much every med school in the UK, which is fantastic. So it's just useful for me because of it. I do try and stay up to date with lots of different universities' admissions process. So if you guys do have any specific university questions, please feel free to ask. So yeah. Okay, so the first thing I'm going to talk to you about is the different types of interviews that universities use. So, would anyone like to be brave and unmute yourself? I want to try and make this as interactive as possible and tell me what's an MMI interview, what's a panel interview, and what's the difference? Sorry, Incy, I'm not sure I can hear you. Oh, I have somebody raise their hand. Yep. Mahak, what did you want to unmute yourself?
So isn't an MMI like they have different stations and then a panel interview is more like there's just a couple of interviewers and they're just asking you questions?
Yeah, brilliant. Fantastic. So the example in the photo would be an example of a panel interview. So thank you very much, Mahak, for unmuting yourself there. And MMI tends to be, so it will be different stations. It can vary in number, about 8, I'd say on average. They're, like sort of 8 minutes each. And they can ask you about lots of different topics, which obviously we're going to talk about. So there's advantages and disadvantages to each. A panel interview is good because you're able to sort of build a rapport with your interviewer and they can get to know you better because you're probably with them for about 20 minutes to half an hour. So there has been a big shift from panel to MMI interviews, but there are still universities that use panel. So Oxbridge will still use panel. Some of the London universities still use panel. So it's important to sort of be aware of them. But you'll find that quite a lot of universities now are using MMI interviews. MMI circuits are good because, well, first of all, they cover a broad range of topics. So you can, so they cover a broad range of topics and they can be useful because you essentially can leave one thing behind. So if something doesn't go so well, and if you've maybe answered something that you think maybe wasn't to the best of your ability, you oh, sorry, I think I was just muted for a second. You get to meet a new examiner that you haven't met previously. So that can be helpful for some students. You can sort of just move on every time. And there's a wide range of skills tested. Also, MMI interviews, I think a big reason for the switch is they actually mimic the interviews that you have, the examinations that you have throughout med school. So you guys might have heard of OSCEs, which are the examinations that med students have every year, where they essentially mimic that style of 8 different stations of questions. Okay, so that was a benefit. Okay, which London universities still use panel? So my understanding, UCL still uses panel. They haven't all released that information updated for this year's entry. But I believe UCL, and I will check that for you and get back to you because I can't remember if Queen Mary's changed or not. And Imperial was still panel the last time I checked. So pretty much all of the London unis. But yeah, I will double check that for you. But I know that UCL do. Okay, and then also somebody's just asked, so when will they release the information of whether it's panel or MMI? So they should really have done it now, but some universities haven't released that yet. They'll definitely tell you when you get invited to interview, and I basically be checking the website from now onwards. Okay. Oh yeah, so I can see here that somebody's updated me that Imperial has changed to MMI. Also, so at this point, I've just been made aware that a few more people have joined the meeting. So I'm just going to reintroduce myself, and then actually I'm just going to quickly pass over to the other tutor to introduce herself. So my name's Antonia. For those that were here before already know that I'm a 4th year medical student at the University of Leeds. And there's 2 hosts today that are going to be basically discussing medical interviews with you, what you can be doing now and things like that. And yeah, sorry, so I've been updated that UCL is now MMI, so thanks for letting me know. As I said, it does change quite a lot. And yeah, Bobby, would you like to introduce yourself?
Yeah, thanks, Antonia. So, hi everyone. Sorry about the delay getting on. There were technical issues on my side. I'm Bobby. I'm a 2nd year grad entry medic at the University of Oxford. So, a little bit of a less traditional route, but I've been through the ballpark a few times now. So, yeah, I'm just here today to help.
Okay, brilliant. So we were talking about MMI stations and panel interviews. So I think somebody asks about role play and whether or not it's more likely to come up in an MMI or a panel. So role play is quite a common feature of an MMI interview. So quite often it is one station. So typical tasks might be talking to a patient about their concerns before going into a procedure. So obviously you're not expected to have any medical knowledge, but you can still provide support, reassurance, and display empathy towards a patient. That's the sort of thing. I'd say it's probably a bit more common in MMI stations, but that's definitely not to say that they can't ask you it in panel interviews. So I would prepare for it regardless. As the thing is with MMIs, more things come up because there's more opportunity for variety because there's different stations, but there's definitely potential for both. Okay, I'm just checking that there are no other.
Just to interject, Antonia, as well, it's possible that in panel interviews you'll still get a role play scenario. So what they'll tend to do is say, here's the scenario, how would you respond? And sometimes they do want you to act it out, but it depends. And I was just typing out a response, sorry, Antonia, to the question about the Warwick MMI online. So they did this a couple of years ago as well. And what they'll do is they use their own platform and sort of move you between stations. So they have rooms sort of like Zoom set up with different interview stations, and they'll move you automatically. Don't worry about it at all. Sorry, passing back.
Okay, perfect. So yeah. Somebody asked if you'll be given props in MMI. So I wasn't in any of my MMI stations. I think it's probably quite unlikely, but they might do. You can't rule it out, I guess. Okay, just checking. Can everyone see my screen? Somebody's just mentioned that they can't.
I can see your screen, Antonia.
Perfect. Okay, great. So we'll move on now to talk a bit about basically the timeline from, well, kind of previously onwards. So we know that we've passed the UCAT deadline and we've passed the UCAS admissions deadline. Okay, so that was on the 15th of October, I believe. And we've passed the BMAT. So now essentially the next big step is the interviews, okay? And then obviously getting through the interviews is the final barrier before your A-level results. And then after that, we're in, okay? So, sorry, I'm just monitoring the chat. So we're going to go through what sorts of stations you can expect in an MMI. And in terms of how long you should start prepping before your interviews. So this is, I've always found this is a bit of an awkward time in that you're not sure where you're going to be interviewed yet, and you've not sort of been given much information about the interviews. But I think now is a really good opportunity to start some general reading. So it might be that you're getting to know a bit about how the NHS works, reading about the NHS hot topics, so staying up to date with the news, and basically being aware of what's really prevalent in the NHS, learning about its challenges, and then as usual just taking steps to basically display your commitment to a career in medicine. So whether that be volunteering in a hospice or work experience, but basically they want to know that like you haven't stopped all of your volunteering the minute you've submitted your personal statement and things like that. So these skills are really important to kind of keep up.
I will try my best to respond to messages in the chat as well as we go along.
Okay, brilliant. Yeah, I was going to say, Bobby, that would be great if you could sort of monitor the chat, and then if you have anything that you want to say, just interject. Okay, so when do I usually get invited for interviews? So this does vary. So I remember for my year, they gave out some interviews in November, but actually they also gave out some interviews for like the beginning of March. So what I would tell you is I basically don't worry if friends or people have been invited to interview and you haven't heard anything yet. Okay, so always go by no news is good news. If you haven't heard, that doesn't mean that you haven't got an interview, because they do it in stages. So some people have had their interview before others have been invited with some universities. So that's generally for MMI universities. Oxbridge have a day that they release their interviews, and so you'll be told on that day. So but you'll also be told if you haven't got it. But yeah, you'll be aware. But whereas some other universities, they kind of give out invitations in dribs and drabs. So it really does vary from the time of end of November to sort of end of February, which can be quite difficult. But I would say don't be too worried if you are hearing of lots of people getting in and you haven't heard, because I know people that had their interviews in March and they were still given offers. Okay.
Yeah, I'd say about the same. So in terms of my timeline for Warwick, I heard quite early on, actually before I heard from Oxford. And so that was probably about November time. And then Oxford was early December. And that's also when they did the interviews. So it's quite a quick turnaround. You want to be prepping, like Antonia said, read around, make sure you understand why you are applying and have a concise answer. Try not to over rehearse, but just have some points in your head. That is one that will get asked in some form at some point. And then I think I heard back from Cardiff and Bangor like April time. So it really does vary on the university.
Yeah, brilliant. Thank you. I'm trying to think about when I heard from my interviews, and I can't remember, but I just remember hearing like before other people, and it doesn't it's nothing to do with like performance, or there's sort of no ranks where the best applicants get invited first and the worst get invited last. So it doesn't really matter like that. So that's why I say don't worry if you are late.
No, not at all. I mean, most of them also did them in batches. So for Warwick, for example, they did a batch in November, and I think they did a batch in February, which is really strange. But it's just their admission process. There's lots of people applying. They want to get through as many people as possible.
Yeah, exactly. Okay, so the next, I've raised hand. Yep. Feel free to unmute yourself.
Hi. I was wondering if you said that it doesn't matter like when they give you the offers, but I thought it was like they ranked their students and then they gave like the top offers first, or like interview offers first. Or does it not work like that?
So my understanding is that it doesn't work like that. So they do rank the students. Some universities rank the students in that, for example, they take let's take Brighton and Sussex, for example. I know that they give a certain number of points depending on your BMAT score. They give points for your GCSEs. Then they put that all in a rank and they invite the top people to interview. But that's not to say that number one of that rank is interviewed first and number 300 is interviewed last. It's random in that process. So some universities rank their students and then have a cutoff for who they don't invite to interview. But that's nothing to do with when you have your interview. So yeah, I don't know any university that interviews like based on their rank position, if that makes sense.
Okay.
They don't. So if it's helpful, they'll have a cutoff score for what you have to have scored in the UCAT or in the BMAT. But beyond that, like it doesn't matter. You'll be put down as either to be interviewed or to not be interviewed, and then they'll just randomly choose days for you to come in. So
okay, so we've had this asked already, I think. So when should you start preparing? So to be honest, obviously you guys are starting to consider it because you're all here, which is great. So I think sort of around now is a really useful time to start getting in wider reading. It's never too early to look at past questions and start thinking about the ideas that that sort of come up. So being confident in medical ethics and making decisions, basically building up a bank of like keywords and things like that you want to be using in your interviews is really helpful. And as I think Bobby said before, it's really helpful to be able to make sure you can talk about like things like why you want to study medicine, but also the classic teamwork, leadership, work experience. It's all well and good that you've done it, but you have to be able to confidently explain it to your examiner or to your interviewer and tell them about why you found it really helpful and what it told you about a career in medicine. So practicing talking is something that's often overlooked, but it's really important.
yeah, sorry, I just realized I'm still unmuted. Yes, I'm just typing away, but essentially I'd say as early as you can, even before you have your interview offers, because you know, the more time you have practiced, the better. And practicing out loud is super important because you can say everything you want in your head and it will come out perfectly and you can erase mistakes. But if you're not used to just talking through your answers, it's going to be really hard for you in the interview.
Okay, so I've just some questions. So do universities ask for any specific certificates of work experience or volunteering to bring to interview? So no, they wouldn't, but it's just important that you can explain to them what you've done and how you found it helpful. So you want to be specific. Some people have said that if you can't continue, you know, is that okay? So if you do have other prior commitments and you have reasons to not continue, then that's okay. Basically, the idea is that you've taken enough steps to show the interviewer that you're confident you want to pursue a career in medicine. So yeah. Okay, we have a hand up. Shrey, do you want to ask your question? Oh, there we go.
Good evening. Are you able to hear me correctly?
Yeah.
All right. My question was regarding the personal statement. Are universities likely to ask you much on the personal statement? Does it vary? Would that help in an interview, or does it entirely depend on the structure? Whereas if it's an MMI or something like that?
So that's a really good question. So generally, personal statements are looked at a bit less now than they were. That's not to say that it won't come up. So there are specific unis that probably will ask you about it. So Oxbridge interviews tend to ask you about it, or they'll just sort of have it in front and maybe basically use an idea from it to ask you questions, if that makes sense. None of my MMI panels asked me about my personal statement, and that was Nottingham, Leeds, and Brighton and Sussex. But they still can. So I would make sure that you're confident discussing everything mentioned in your personal statement. So yeah, because also some universities do.
Yeah, I mean, I got asked a question about it, but it was more, so this was my Oxford interview. It was more they picked something, they wanted me to talk about it a bit more, I guess, to prove that I had a life beyond medicine. So that's, yeah, I think the personal statement's obviously important. And it's also a practice of you reflecting on your work experiences, which is so helpful for interview prep, beyond anything else. But yeah, that's my thoughts on it. So back to you, Antonia.
Yeah, definitely. And then somebody's asked a really good question of, is it worth doing an EPQ, and will they ask that in interviews? So my understanding is you would have already picked whether or not you're doing an EPQ yet. Is that, I'm thinking that's right. But
yeah, that's tend to be it.
Yeah, but an EPQ is a brilliant thing to do pre-med school. So they won't specifically ask you about it because it's definitely not a requirement. So I don't want anyone to worry if you haven't done an EPQ. That's completely fine. But if you have done one, it's something so useful to bring into interviews. So it shows research skills and primary research skills. And the idea is that can be really helpful throughout med school. So you will undertake in mini or really big research projects throughout med school. So it sort of, first of all, just shows an interest in general for the world of research, and shows that you have skills that you're going to then go on to develop. So EPQs are great, definitely mention them, but they won't ask you about it. So it's up to you to bring it in. Okay. Okay, I'm just scanning. I'm going to move on and then I'll go back to the chat. Yep, I have a hand up. Oh, I have to unmute, don't I? Sorry, keep forgetting that.
Hi, can you hear me?
Yeah.
Actually, I wanted to ask, I want to apply for dentistry, but the more conferences I rolled in for, there was just more generally for medicine and dentistry. But I want to ask, how can I be more prepared about dental field? Because they most told me they're really general and they're near together, but I want to be more specific into dentistry. So what else should I do to be more prepared?
Okay, so that's a good question. So generally, I know that obviously dental interviews, they replicate the same sort of like the MMI style, most of them.
Mm-hmm.
So practice is good, and the same ethical questions. Generally, the ethics is applied. The same ethics should be applied to medicine and dentistry. Specific dental resources, to be honest, I'm not sure. But because I'm a medical student, but I think if you generally looked up dental interview questions, these things would come up. But medical interview resources would also be really helpful.
Okay, so it's more general. If I look at the ethics, it can work for dental interviews as well.
Yeah, I think that the key ideas that it uses, definitely.
Yeah. Okay, thank you so much.
And there was another question. Oh, Selena.
Hiya. If it's okay, I'd like to ask you two questions. One of them is, I have an extenuating circumstance and I receive free school meals and I'm on a bursary from my school. I gave this information to the universities that I apply to, how would this benefit me? Would I be able to get a contextual offer? Would they give me a chance into interview?
Antonia,
Okay.
can I actually help with that?
Yep.
So I was in a similar position when I was applying. I had free school meals when I was growing up. I had extenuating circumstances. You do end up getting a contextual offer if they're aware of this stuff, and if they're like, yeah, we like your interview, we want to give you an offer anyway. It varies on the university and the criteria they have for contextual offers. But for example, when I first applied, I got an offer from Imperial, and now Imperial are notorious for giving really hard offers to get, so A star, A star, A, but they brought it down to AAA for me. So it does make a difference, if that helps. I don't know if Antonia's any more experienced than that, but
My teacher put it down on my reference, and I also gave in extra information as well. For example, for Kent, they asked me to sign a form to let them know of like the circumstance and the free school meals, etc. So would this help me get a place, or just after the interview, if they do offer an interview afterwards, they might, reduce the grades needed?
so from what I know, it might be that they'll reduce the grades needed, and if they're looking at your GCSE grades, which some places do, they'll look at it with a bit more context, which so if you went to a school in possibly a disadvantaged area, they may, compared to other people's GCSEs, weight yours a bit higher. So it really depends. It's less likely they'll be using that for deciding to interview you, other than potential GCSEs, but it is relevant for when they give offers, if that makes sense.
Yep. And if you don't mind, I'd like to ask you another short question. In the interview, when they ask you why medicine, how can you put your true self out there and give an honest opinion and stand out?
Antonia, do you want to take that one?
Yeah, sure. So I think that's a question that is quite a lot of students worry about. So the basis of the question tends to be the same amongst students in that, like, I'm not saying you should say this, but love science and love people, like, how everybody sort of starts with that. The important bit that's going to make you stand out is telling me about examples of where you've shown that. So what sort of work experience have you done that's basically made you confident that you want to study medicine? What did you love about it? Alternatively, were there any challenges that you encountered that you think were really, was a really good learning opportunity, and how have you reflected on that? So really, it's all about how you've reflected on what you've done. So it's not interesting to interviewers telling them that, you spent a day at this ward and you did this and you did that. I want to know what you took home from those experiences and how it made you want to study medicine. So the basis, it doesn't make you stand out, but your examples to support your points will make you stand out.
Okay. Well, thank you so much, guys.
No problem. Okay. So now we're going to talk a bit about sort of what comes up in interviews. So if you guys could bring up, okay, so great. I've already got some people answering. So what do you think they could ask about? Feel free to keep adding. But yeah, so we talked about personal statements can come up. So a lot of these things that, for example, volunteering, work experience, extracurricular activity, quite often there won't be specific questions about it, but it will be up to you to tell the examiner about it, the interviewer, okay? So often they won't specifically ask you about like the volunteering that you've done, but what they might say to you is, tell me about time you've worked in a team. And then that's up to you to then go and show off your skills, okay? So yeah, sorry, it's moving so much. So yes, people have mentioned some hot topics there, which is really good. So antibiotic resistance I'm seeing, which is good. So it came up quite a bit a couple of years ago. I would definitely make sure you're confident talking about it. I did see the strike somewhere. So again, obviously strikes is very, very current affairs. And I think across the med schools, there will definitely be questions about it on the basis of understanding, but also the ethics behind it. So you want to start thinking about formulating a view as to whether or not you think it's ethical to strike, and making sure that in that approach, you're being sensitive to your audience of who you might be talking to. So yeah. We're just having a look. Challenges in medicine, so really important. Yeah, so I do see sometimes a lot of students go into medicine with perhaps somewhat an unrealistic expectation of like, of like glamorizing medicine, and it's all about saving lives and everything like that. And whilst it is like a fantastic career path, it's not without its challenges. And I know that interviewers respect candidates a lot more for acknowledging these challenges and showing that they've sort of taken X, Y, and Z step to make sure that they still want to do medicine in spite of these challenges. Okay, so there's sort of constant stigma around, not stigma, what's the right word, sort of constant negativity surrounding working in the NHS. And I think it's really important that you're aware of that, you acknowledge that, and you still want to do medicine anyway, instead of overlooking it. So yeah, I personally really like it when students do mention the challenges. And yeah, being able to address your weaknesses, teamwork, leadership, definitely. Okay. So I think, okay, so what I want to do now is I want to just basically go towards the first example. So this is completely for your benefit. So if anybody wants to be brave and unmute themselves, and raise your hand if you do, because then I think I have to unmute you, and tell me about basically what inspired you to become a doctor. If you can, tell me about a time that you saw a patient on your work experience or during your volunteering who inspired you to find out more about what was wrong with them. So I'm going to give you guys a minute, and feel free to raise your hand to unmute yourself. Okay, brilliant. So Shreya, I've unmuted you. Thank you so much for raising your hand. Feel free to go ahead.
Hi, I hope you can hear me okay.
Yeah.
This isn't going to be like best answer, I'll be honest, but I think when I first started thinking about medicine, it was because I had a lot of family ties to medicine. So first of all, a lot of my family were already like in the medical profession, so I kind of knew a little bit about it. But then also, I was able to kind of look into like the patient experience through the eyes of the patient, because my sister was born with like a rare genetic condition, which meant we made many trips to Great Ormond Street. So I spent a lot of my childhood kind of wandering around the hospital hallways, and that kind of got me definitely more interested. So I started doing work experience and work shadowing in lots of different places, so hospitals, GPs, and I even did some abroad. And I think one patient that I found quite interesting to like learn about was it was actually in Great Ormond Street. So I was in the pediatric CICU, and I was watching a heart transplant happen. And I learned a lot of things that I didn't actually used to know about heart transplants, especially in young children. So, for example, the fact that they keep the chest open until the child is taken back to the ward where it is finally sewn up there due to swelling. And it inspired me to kind of learn a bit more about the transplant process in general. And then I got interested with lots of transplant news. So I read recently about a child who had a kidney transplant who would not require to have immunosuppressant for the rest of her life. Also about the news of the man who had a pig heart transplanted into his body. So kind of being able to link real life incidents of things I had seen and being able to link them with current like medical advances that were happening was kind of one of the main reasons I was really interested to go into medicine. But yeah.
Okay, brilliant. Yeah, fantastic answer. Thank you so much for unmuting yourself there. So it's really good practice. So just for you guys, obviously it's very informal. So it's basically for your learning opportunities to volunteer. So that's really good. So really interesting answer. So I think the good bit about your answer is that you're saying that you saw something interesting, okay, on your work experience, which is exactly what the question's asking you to do. And then you're saying what steps you then took to learn more about it. So reading the news and being up to date about, so you've sort of seen something interesting, but you want to know about what's going on in the sort of wider field of pediatric heart transplants. So yeah, really, really, really good. So in terms of, you mentioned that you have a medical family background. So for anyone out there that does, whilst that's fantastic and it can provide you with really useful opportunities, sort of before and throughout med school, generally it's encouraged to not talk about that in interviews. Only reason being is the interviewer, and you sounded very sort of confident, so I have faith that you want to do medicine, you know, for yourself. But obviously there's sometimes runs the risk that it's like more of a following in your footsteps thing. So generally interviewers want to hear that you've decided to make the decision. So generally we're just told to admit the fact that we have like a family medical background if you do. But that's the only like comment I had about that. Okay, Fatima, do you want to unmute yourself? I see you have a question, or I need to do that. There we go.
Hi, I was gonna answer the question.
Yeah, go for it.
Okay, so both of my parents have chronic illnesses, including psoriasis and arthritis, and that initially sparked my interest. Although there's like no cure for it, I have witnessed the dedication and perseverance the doctor have demonstrated in order to help my parents live a satisfied life. I go to their appointments as an interpreter, which helped me recognize the strong bond that has developed between the doctor and my parents. And that allows them to share information that they wouldn't normally share with a stranger. And this really highlighted the importance of building a rapport with them. And this interest of pursuing a career in medicine was developed through my working experience. I witnessed an interaction between an anesthetist and a patient pre and post surgery. The anesthetist asked various detailed questions about the patient, making sure they were mentally and physically prepared, as well as asking if they had any concerns. And I've come to realize how important it is to check on patients before putting them to sleep because they have a lot of trust in these medical professionals. So then, at the end of the surgery, I remember the anesthetist took care of the patient. After they were transferred to the recovery room, they monitored their progress and again asked if they had any questions or concern to emphasize how important the patient welfare was.
Okay, brilliant. Yeah, thank you so much for unmuting yourself there. That was a fantastic answer. So really good. I think that was overall really interesting. So I really like how you talked about the interaction with the patient and the anaesthetist, and how you mentioned about the patient's mental and sort of physical preparedness to go into surgery. So I think that's really important because actually we know that, so of course the patient needs to be physically ready, they need to have all of their observations done, but actually we need to make sure they feel okay and not alarmed and not terrified, and that their questions have been answered. Because we know that can affect their recovery, so really important. I like the fact that you mentioned asking about a patient concern, patient's concern. So yeah, really important. And I like the idea of basically, if you think about before a patient goes into an operation, it's likely that they're in one of their most vulnerable states. So if you can employ those sorts of communication skills and empathy to put them at ease, that's a really, really impressive attribute. So really good. So interesting that you talked about sort of chronic diseases. And I was just going to say that you talked about family, and then the question says work experience, but then you really sort of brilliantly brought in an example from your work experience. That was great. And I think you talked about sort of the ability to witness continuity of care throughout a patient's admission, which is really interesting. So well done.
Thank you.
Okay, Alex, do you want to have a go, or did you have a question? Oh, I need to unmute you, sorry.
I was gonna see if I can have a go.
Yeah, go for it, and then we'll move.
So I first wanted to become a doctor when one of my family members had a heart attack, and I just witnessed how like the doctor like broke news and built rapport with us, and just it inspired me to help other people to not do that. And so I volunteered to work in a care home as my work experience. And one of the women there, when she came in, she was very, very tearful, and I had to reassure her. And I just thought that was nice. And so I liked the link between like the mental health and the physical health. So I listened to, it was a podcast on Arden House, and it talked about an experiment, maybe 90s, I'm not sure, where they gave the residents a potted plant, and the residents chose the plant and everything like that. And it found a link between the independence of the patient and actually living longer. And I just thought it was very interesting and helped my interest in medicine.
Yeah, brilliant. Thank you, Alex. That was really insightful. So yeah, you addressed quite an important idea there, that link between a patient's physical and mental health. So quite often doctors we do find they become obsessed with patients' physical health, but we find that mental health can be overlooked. And actually the two go hand in hand. So sort of as we mentioned in the last example. So yeah, I think that's really interesting. Again, you've shown me that you've sort of listened to podcasts, you've gone like the extra mile to find out more about something that interests you. So that's really good. And I think volunteering in a care home, the example when you said that the patient was very tearful, that's really interesting, because often, obviously, we treat patients when they're unwell, and quite often when a patient's unwell, there's sort of associated distress with that. So yeah, we need to make sure that we can treat them. So, Sasa, did you have a question, or did you want to have a go at this?
Oh. I think they have a question.
Yeah, I have a question.
Yeah, go for it.
So I'm actually an American student applying, and I'm wondering if there are any specific things I should prepare for, like if they're going to ask me why I'm applying in the UK and that sort of thing.
Yeah, so I had a student who was applying from Australia, a student I was tutoring, and my advice to you is to make sure you understand roughly how the NHS works, and come up with a reason for why you want to come work in the NHS for a little bit, and why the UK over America. Just because it's interesting, they may ask you that, and it's better to be prepared and just have something in your back pocket.
Yeah, I would agree, definitely. Alessia, do you have a question? Oh, we could do that.
Hi, yeah. I wanted to ask you if I had experience of medical help outside of Scotland, of the UK, and you know how we were talking about the negatives of the NHS as well. Would compare it with other countries, the experience I had in other countries be something that would benefit, or would that just look a bit judgmental of around the NHS?
So that's a really good question. So I always tell students to have an idea about at least one healthcare system in another country. I generally say learn about one where they function differently to the NHS, so that you can compare, because it is really important to be able to compare. So quite a classic example that people learn about is the USA, just because they have a private healthcare system and ours is obviously public. But I don't think that it would look judgmental at all, because actually, if you're answering a question about, obviously we're the future generation of doctors, so interviewers want to hear that you have insightful comments about how to improve our healthcare system, because our healthcare system is not without its faults, okay? And being able to acknowledge that and offer suggestions for improvement is really impressive. So if you think something particularly well, if you observe something that went particularly well in a different healthcare system, and you think it's like applicable to the NHS and it can improve patient outcomes and things like that, that's definitely something worth talking about.
And also sometimes sorry, Antonia.
No, go on.
Sometimes they actually ask you to talk about the negatives in the NHS, and what they're really looking for is to see that you would be willing to still put time into that healthcare system, because ultimately the hope for a lot of UK and universities for medicine is that they will be pushing you into the NHS afterwards. But yes, it's just be cautious that you're not coming across as, yes, the NHS is completely terrible and therefore I'm not going to work in it, but I still want to study medicine, because they want you to be more balanced than that. And yeah.
Yeah, definitely. I agree. So I think the idea is that you don't want to just go into your question slating the NHS, but you want to explain to them how you think it could be improved. Okay. So yeah. So I've unmuted the people with questions. Does someone want to ask you a question? Yeah.
Yeah, actually, I had a question. You already said like it's better not to mention your family background, and you say like why I'm interested in. But the thing is, like I gained like my work experience like in my father's clinic, and the thing I'm international, so I cannot like go to NHS like here to gain work experience. So it was easier for me to gain work experience in my home country. And do you think should I mention like the thing actually inspired me was like my just looking my father working, and like because I'm familiar to that like that rather than any other like courses or something like that?
Okay, so it's a good question. So I don't think it matters how you got your work experience. So you don't really need to mention that. I think it's more I don't know, Bobby, if you would disagree with me, but I think that it would be more beneficial telling your interviewer about what you learned from observing a doctor in general or the healthcare professionals in general. I don't think there's any need to mention a family, but basically what you learned from the experience and what it taught you about medicine.
Yeah, I
okay,
totally
and
agree.
how I got like really inspired, like because my interest just came from the knowledge I got from my father. Like I always like saw him like how it works, and like the books that he always was reading, like I was interested in. Should I maybe mention this or?
So I think it's definitely completely valid. So I can understand sort of how that happened. I think I would just go on to tell them about what you're interested in, not necessarily how you got there. I don't know, Bobby, if you would agree.
Yes, I'd agree that it's more important what you were doing. So like when I would be answering a question, I wouldn't say, oh, I got this work experience through so and so. I'd be in this work experience, I saw this, I found this interesting, I learned this, this is how it's developed me, this is why I'm now good for medicine. It's more important about you reflecting on your own journey than on how you got to that point, if that makes any sense.
Yeah. Okay. Thank you so much.
Okay, so I still have some more questions. But I'm just gonna at this point, I think, Bobby, since you're an Oxford, since you study medicine at Oxford, I think, do you want to tell everyone a bit about the interview process in Oxbridge?
Yeah, of course. So you'll probably know that the interview process at Oxbridge is a little bit different to the standard interview. So at Oxford and Cambridge, it's a panel interview. So you'll have tutors at colleges, I'll explain that in a minute, across from you, either virtually or in person, and they'll bring something for you to look at. Typically, it'll be a graph, and they want you to just say what you see and talk yourself through it. And then they might ask you a question related to that graph, and all they want to see is you thinking out loud because they want to see your thought process being logical. The actual setup, at least for me, I was interviewed at 2 colleges. That's standard as far as I'm aware. And I had 4 interviews. So I had 2 interviews at each college with different people each time, which I think is really good because if you mess up one, it's fine. And so you'll have those interviews, and then the colleges will independently say whether or not they think you're suitable for medicine. And then the one that you either applied to or got assigned to, if you did an open application, gets first pick, and then it goes to the next one. So they'll ask you weird sciencey questions. It doesn't matter whether or not you know the answer. So I put an example in the chat being, why do dragonflies fly? You know, it's a random question, which I don't think anyone's really studied at A level or lower or whatever. It's more, can you reason your way through a problem? Great, you can. Let's move on. And then it becomes a lot more like the standard questions of why medicine? Why Oxbridge? What have you learned from work experience? And then they'll often give you an ethical scenario as well, which, if I'm not mistaken, we'll sort of go through at some point. But that's really important for all your interviews. I don't know if that helps, but
yeah, brilliant. I think that was a really good answer. Perfect. Okay, so I think we had a question about role play before. So we've got 10 minutes left. So what I'm going to do is I think I'm going to let you guys have a chance to read this role play because I think it's really good practice. And then I don't know if Bobby, you would like to act out as Deji, or I'm happy to do that in the last sort of 5 minutes.
Yeah, so
I'm happy to do it. I've done this.
I will act as Deji. That's fine by me.
Yeah.
Yes.
Okay. Perfect. So I'm going to give you guys a minute, and if someone really brave wants to have a go at this station, then that's really good. In the meantime, I'm going to unmute the people with their hands up. So I think I've unmuted everyone with their hands up if you want to just go ahead with your question. Okay, Jordan, did you raise your hand to have a go at this?
It wasn't regarding the MMI station, just about ethical scenarios and what they could ask you in an interview.
Okay, so ethical scenarios in interview. So to be honest, there is a really, really wide range of things that they can ask you. Okay, so what I would do in terms of basically looking at past scenarios can give you a really good idea. But to get a better idea about sort of the things you want to be talking about, if you just have a look at the GMC guidelines, they're essentially a long list of tips and tricks to be a good doctor and things you need or skills you need to employ that will make you suitable or fit for clinical practice. So the GMC guidelines is a really good way to start. They can give you sort of any scenario that you think might be plausible in a hospital setting, or not even in a hospital setting, sorry. So a lot of it is things like you might see ethical considerations when treating children in people that don't have capacity, contraception in young women. There's a really treating dementia patients is a really, really big range.
Okay, thank you.
That's okay.
Just to add to that as well, ethical scenarios is usually about consent and confidentiality. So in terms of looking at the GMC guidelines, there's a lot of information there. So I would definitely say read through some of it and skim most of it. But I would spend some time really looking at the confidentiality section in particular.
Okay,
Yeah, I would definitely agree with that. So there are certain situations in which healthcare professionals are allowed to break confidentiality, but they are really specific situations. That's all mentioned in the GMC guidelines, but we will also be talking about that in later sessions. So that's a really good way to start about finding out when we can do that, because it's quite a common thing to be asked about, as Bobby said.
Thanks a lot.
Okay, is there anyone that wants to have a go at the station, or I'm quite happy if you guys would rather the last 5 minutes to be questions, and we can sort of do the practice another time. I don't mind.
I think what we can do, Antonia, is we'll move on to the questions just because of time purposes, if that's fine. Are you happy to move on to the next slide because I think some of the students are asking about what resources we should use. Sorry, my name's Ashir. I'm from Medic Mind. And I thought what we'd quickly cover before the Q&A is just what sort of resources to use. So obviously there's quite a few books out there and a lot of materials. I would say the number one resource at your disposal is keeping up with the news and making sure that you're practicing with people around you as well. There's lots of resources out there which you can keep up to date with NHS hot topics like the BBC health section. There's also an ebook that we provide as well that you guys can go ahead on our website and get, which outlines pretty much any topic on the interviews. But sort of our number one resource that we sort of provide is our one-to-one tutoring. Antonio, you happy to go to the next slide if that's okay? Thanks. So what we do in the one-to-one tutoring is basically where you'll have tutors like Bobby and Antonia, who've got years of experience behind teaching students for the interviews. And usually what we'll do is teach you, just like in these interviews, what you should be saying for different types of topics, how you should be answering the questions, and what the admissions tutors are looking for. We also do university-specific mocks. So we sort of use the format, the questions, the layout in a similar fashion to help prepare you. Is it okay if you go into the next slide, please, Antonia? And if you guys wanted to book that, you can just screenshot this over here. We're giving 50% off the trial lesson. Just bear in mind, I did update this earlier, but I'm not sure why it doesn't say that. In the chat, I'm putting the actual code for 50% off. So it should be new trial 50 rather than trial 50. Just keep a note of that if that's okay. I've put it in the chat as well, so you can just screenshot and then you keep that for later. Is it, Antonio, okay if you move to the next slide, please? And just as a quick one, we do love feedback from students. Antonio and Bobby have done a really great job today. And thank you again, guys. I've just been listening in throughout the session. But if you guys are happy to leave some feedback for us, we're going to choose 2 students who will get 1 hour of the one-to-one tutoring for free. So if you just scan this code, we'll give you about 2 or 3 minutes to go ahead on that website and just leave us some feedback. But if you can just leave your email address in the Zoom chat so that we can then come back and choose 2 winners. So if you scan this code and once you've left the feedback, leave your email address in the chat, please. I'll put the link in the WhatsApp. I mean, not the WhatsApp, in the Zoom chat as well. And then we'll move on to the Q&A in about 2 or 3 minutes, if that's fine. I think what we'll do, guys, is we'll keep the Q&A about 5 minutes, if that's okay, just because we're slightly running over, less than 5 minutes, but I'll stay around because Bobby and Antonio have busy evenings as well.
Okay, so in terms of how the Q&A can go, so maybe instead of monitoring the chat, 'cause I know everybody's sort of putting their emails in it, if anybody does have questions, if they'd like to raise their hand, and then we'll unmute you and we'll answer your questions over the next sort of 5 minutes.
That works well. Yep.
Brilliant. So we'll start with Cherry. Do you want to ask your question?
Hi, so I'm a gap year student. So from now until interviews, I was sort of curious about whether they expect me to have like a stable job or anything like that, because I have been applying for jobs, so I'm just worried that like I won't have the sort of like, if they ask me, oh, what you've been doing for your gap year, like I'm a bit worried that with that lack of sort of clinical job, then it might put me at a disadvantage.
Okay, so I think so it's really unlikely that they would ask you about like specifically about employment in your gap year, so it's not a requirement. But what I think is really useful is that they can show that you can show your interviewer that you've made the most of your gap year. So basically just by telling them sort of what you've done, but that doesn't need to be employment. It can be lots of volunteering, it can be work experience, it can be lots of research, it can be like going to lots of lectures, conferences, that kind of thing. So it's really not limited to employment, basically just showing that you've used the year to prepare you more for medical school, I'd say.
Yeah, I agree. Which is why I'm not adding too much to that. It's yeah.
Perfect. Raya, do you want to ask your question?
Yeah, so our school has been telling us that I think some universities use our BMAT essays as part of the interview. Is that true? Or because I've not seen much about it elsewhere, so I just wanted to confirm.
So I've answered that question a couple of times in the chat now, but what I experienced with it wasn't used at all. However, some universities like to use, so the main ones that use BMAT at all are Imperial and Oxbridge. For my interview, I didn't have it, but I know some people who did. So if you remember your BMAT at all, maybe just make a couple of notes on what you wrote, if you can, or maybe the theme that came up, just so you have an idea in advance of what you did.
Okay, yeah, sure. Thank you.
Yeah, definitely. And just to add to that, so when I know that Leeds has changed to UCAT now, but when it was BMAT, one of the MMI stations was your BMAT essay. So mine was brought up for my year. Mine was also brought up at Brighton and Sussex. So yeah, it can come up. So I would just say remember it. And quite a common question. So when they used to ask at UCL, that a classic question was, recognizing the fact that you wrote it in October, has your mind changed since? So basically just asking either for you to consolidate your views and about what you wrote, or offering alternative views and showing that you've reflected on what you wrote. Okay, Grace.
Hi, I just have a question about ethical scenarios. So, let's say the interviewer proposed quite a difficult scenario in front of you, and you know that there are two sides to this, and you sort of weigh it up, but then you're kind of unsure about how you'd respond, like what your action would be, what you would do, because you know there are two sides to this, but you're not sure what your answer would be. How would you go about answering that question? Because I think what I can do is weigh it up, but I'm not sure what my response would be ultimately.
Yeah, so that's a really good question. So I think anytime you get a very sort of complex ethical scenario, I think it's really important to introduce it by recognizing the complexities of it. So recognizing that it's a sensitive issue, that there are lots of sort of valid reasons for and valid reasons against. And then you always want to give a balanced argument. So make sure you give reasons why people might support the view and reasons why people wouldn't. If it's something that really tends to be quite 50-50, and it's not unlikely. So for example, if you were to ask about if you were to be asked about something really sensitive like physician-assisted suicide or euthanasia, okay, as long as you've given reasons for, given reasons against, it's not necessary to say overall what you think like is completely black or white, okay? So you can sort of conclude in a bit of a grey area as long as you've supported your answer with lots of different examples.
Yeah, and to add to that, ethical scenarios are meant to be challenging, and it's perfectly okay to sit there and say, wow, that's difficult. I'm just gonna have a second to think about it and then talk about it. And again, with these scenarios, they want to see that you're reasoning out loud. And I said this in the chat, but that just means talking through as you're thinking, so that they can see how you're coming to a conclusion. I think that's more important than necessarily the conclusion you come to. So there is a framework I recommend people use, which is FRIES. Have a Google, but it's about consent largely. And that's going through your autonomy section and then going through non-malfeasance, going through beneficence and justice, and sort of just going through those four things as different categories and talking about both sides of the argument. It's okay to be unsure. It's okay to express that. They may still push you and ask for an answer either way. So things like euthanasia and assisted suicide, I say if you're unsure, it's safer to go with the UK's laws on that and say, I feel unsure about it, but this is the way that the laws are, so this is the way I would practice, if there's any help.
Definitely, I would agree. Okay, so I'm conscious of the fact that we've been running over. So I think I'm going to stop the session there. So I'm going to stop sharing my screen with everyone. I'm aware of the fact that people do still have their hands up. So I am just going to pop my email in the chat. And if there's any burning questions, feel free to email, or we can address them in the later session. So this is going to be a weekly thing. So feel free to jot your question down and bring it to the next session.
And I'll do the same thing. I'll put mine in the chat. Just to answer a question, because there's been a few about GEM. I do think that GEM is slightly harder to get onto, but just because there are fewer universities that do offer GEM and there are so fewer places. But the same sort of practice and preparation will help you with either GEM or undergrad applications. It depends on why you're applying for GEM, if it's because it's a second degree or if it's because it's funding, or you think that you can handle the accelerated nature of the course. So have that clear in your head. I applied because of funding. It's easier to fund grad than undergrad, but that's a different conversation for another day. But yes, it's important to have why you're applying for a specific type of course in your mind when you're doing that.
Okay. Okay, well, thank you so much, everyone. It was lovely to meet you all, and thank you to everyone that contributed, and see you next week.
Thank you, guys.
Bye.